Is there any way to make eyelids even without surgery, glue, or tape? My right eye is perfectly normal, but my left eye is smaller because of my eyelid. I don't have extra skin on my left eyelid though. I really want my eyelids to be even. I would appreciate it if you could answer my question. Thank you.
Thank you for your question. You're asking, is there any way to make eyelids even without surgery, glue, or tape? And in your question, you describe a scenario where, with the photos that you did submit, that your right eye is fine and your left eye is low, and you make a point of writing that there isn't extra skin. So certainly I can assist you with understanding what the situation is in terms of being able to do something without any of those interventions you described in your question. Well, that's a different story because you really have to understand what the underlying issue is. A little bit of background: I'm a board certified cosmetic surgeon. I'm a fellowship trained oculofacial plastic and reconstructive surgeon. This means that after completing my residency in eye surgery, I did fellowship training specializing in complex reconstructive and cosmetic surgery of the eyes and face. I've been in practice for over 20 years in Manhattan and Long Island, and in particular I've had a practice focus on Asian eyelid surgery as well as dealing with the complexities of revision surgery and drooping eyelids and ptosis surgery. So, that being said, let's understand a little bit about what your anatomic issue most likely is. Now, of course, this is limited by the only the photos you submitted, but by the history you describe and the photos you submitted, what it appears to be the situation is your relative to the right eye, your left eye has something called ptosis. Now, ptosis is a condition involving the eyelid, or it actually is a general condition when it affects other parts of the body. For example, the breast, you say it's breast ptosis. This is a situation of eyelid ptosis. When you state that there's no extra skin, well, certainly it eliminates the benefits of using glue or tape, which is often the situation when you're dealing with extra skin. But when we talk about ptosis, you're talking about the position of the eyelid. We have to make a distinction between ptosis and dermatochalasis. Dermatochalasis usually means extra skin over the eyelid, and ptosis means that the eyelid is low relative to the pupil. Now, that in someone who is younger and has ptosis, very often it's because they were born with ptosis, and that's referred to as congenital ptosis. If you are a little bit older and you develop ptosis for a variety of reasons, it's called acquired ptosis. The reason I'll address this as if you were born with this condition, and that means that essentially the muscle that lifts your eyelid didn't form in a way that was complete. In other words, the muscle doesn't necessarily contract as well as a normal muscle, and this muscle is called the levator muscle, like the word elevator. And it is a muscle that doesn't contract normally, nor does it relax normally. So, when it comes to correction of a situation like this, you need a proper evaluation. And during that evaluation, for example, I will have a patient look up and look down and assess the relative muscle function. I'll look at their eye health. I'll look at several factors to give them guidance. Unfortunately, the only long-term way to treat ptosis is with the surgical procedure. And ptosis surgery is a surgery that is remarkably challenging in trying to achieve the most optimal symmetry, height, contour. So actually during ptosis surgery, we have the patient sit up during the procedure, and we actually have them open their eyes so I can assess and make sure that the eyelid looks its best. These procedures are done under local anesthesia with light IV sedation. Basically, in order to achieve this optimal result, it's important for me, dealing with mostly adults, to have cooperation so that a person is able, so I'm able to see what is more likely to be when the procedure is done. This muscle is very delicate. It's very temperamental. It really has to be handled in a way so that you really get the most predictable result. Now, risks of this surgery do include having an overcorrection or undercorrection, but I think that just to simply answer your question, there really isn't a way. Now, in some situations, when a person has a very, very mild ptosis, there are times when you can actually use an eye drop that can stimulate a muscle called Mueller's muscle, and that muscle will contract for a little bit and will elevate the eyelid. Occasionally, that method is employed for the benefit of photos, taking pictures. But otherwise, to get the eyelids to look more even, well, surgery is probably the only option that you can use to achieve this. Now, understand that within the normal population, it is acceptable without being cosmetically obvious or significant to have the eyes be within 1 to 2 millimeters of each other in terms of relative height. But if there is a very obvious difference that you see all the time or people point out to you, it's probably worth considering surgery. So meet with qualified experts, and usually the expert that you want is an oculoplastic or oculofacial plastic surgeon, someone whose background, like mine, is in ophthalmology before doing surgery, learning surgery of the eyelids, the orbit lacrimal system, and learn about your options. Also, I think I would add that it's important to have someone who has a lot of experience with Asian eyelid surgery. The importance of that has to do with the anatomic differences between Asian and non-Asian patients. It's very important when considering this type of surgery. It just adds another factor of complexity that just needs to be handled appropriately and maximize the likelihood of success. So I hope that was helpful. I wish you the best of luck. Thank you for your question.